Ever pondered over the intricacies of diabetes mellitus? That seemingly innocuous term your physician throws around, or perhaps a condition a loved one grapples with? Today, unraveling the secrets of this chronic metabolic disorder becomes your personal mission. Diabetes mellitus, a condition that has been around for millennia, is characterized by high blood sugar levels. But why should this matter? Well, sugar, or glucose as it's scientifically known, is the body's primary source of energy, and when its levels in the blood aren't regulated, it can lead to a host of complications. Now, imagine a city. The buildings are the body's cells and the people are glucose. For the city to function smoothly, people need to enter and exit buildings. In our bodies, insulin acts as the doorkeeper, allowing glucose to enter cells. However, in diabetes mellitus, either the doorkeeper is absent or the doors aren't working correctly. This leads to a glucose traffic jam in the bloodstream. There are two main types of diabetes mellitus, type 1 and type 2. Type 1 diabetes is akin to a city with missing doorkeepers. The body's immune system, in a case of mistaken identity, attacks the insulin-producing cells in the pancreas. This means glucose can't enter cells, leading to high blood sugar levels. This type of diabetes is usually diagnosed in children and young adults, and while it's less common, it's certainly not less significant. On the other hand, type 2 diabetes is like a city with faulty doors. The body either doesn't use insulin properly, or it doesn't produce enough insulin. This results in glucose building up in the blood. Type 2 is the more common variant, affecting the majority of people with diabetes. But it's not all doom and gloom. Diabetes mellitus can be managed, and those with the condition can lead a healthy life. For type 1, the doorkeepers need to be replaced, and this is done through regular insulin injections or the use of an insulin pump. Type 2, however, requires a bit of door maintenance. This can be achieved through a healthy diet, regular physical activity, and sometimes medication to improve insulin function. But remember, knowledge is power. Regular monitoring of blood glucose levels is crucial in managing diabetes. It's like having a traffic report for the glucose in your bloodstream. To sum up, diabetes mellitus with its two types is a condition of high blood sugar levels caused by issues with insulin production or function. It can be managed through diet, medication, and regular monitoring. And remember the city analogy? Well, here's a little humor to lighten the mood. If our bodies are like cities, then let's just say, in diabetes mellitus, the city's planning committee needs to have a serious meeting about their doorkeeper staffing and door maintenance issues. So, the next time you hear the term diabetes mellitus, you'll know it's not just a fancy medical term, but a condition that affects millions worldwide, and one that can be managed with the right knowledge and care.